My name is Dr. Michelle Bennett. I'm a board-certified pediatrician and mother of 2. You may be worried if your baby is lactose intolerant. While it's very common for older children and adults to have lactose intolerance, it's actually very uncommon for babies to have lactose intolerance. Lactose intolerance is a condition where the body cannot break down lactose, which is the main sugar that's found in breast milk and most infant formulas, and is an important source of energy for babies. For rare babies who do have lactose intolerance, they'll generally have chronic diarrhea and gastrointestinal upset from birth. This is seen in babies who are born with an abnormal gene for lactose metabolism, which is quite rare and again, not the same as the lactose intolerance that older children and adults develop with age. Most of us are born with lactase in our intestines, and that lactase helps us break down lactose in milk to be used for energy. As we get older, many people's bodies naturally produce less lactase, which can lead to a lactose intolerance. That's why actual lactose intolerance is so rare in babies, and it's not uncommon to confuse other food sensitivities such as cow's milk protein for lactose intolerance. This is why it's always so important to speak with your doctor. You want to make sure you get to the bottom of what's behind your baby's sensitivities. It's also worth noting, infants can occasionally develop a transient lactose intolerance if they've had a major stomach virus that's impacted their gut's ability to digest lactose. In this case, a baby might be put on lactose-free formula for 2 to 3 weeks to allow their intestinal tract time to recover. If you notice concerning symptoms in your baby, it's important to visit your pediatrician to rule out other causes of these symptoms. If your baby has a lactose sensitivity, you may need to switch to a lactose-free or low lactose formula. There are several brands of lactose-free formula in the market that can provide complete nutrition for your baby. Some of these formulas are soy-based, while others are made from hydrolyzed proteins that are easier for babies to break down. It's important to discuss with your pediatrician before changing your baby's formula or switching from breast milk to formula. They can guide you on the best formula for your baby based on their age, weight, and nutritional needs. For parents who are breastfeeding, if you suspect your baby might have an intolerance, it can sometimes be helpful to remove dairy from mom's diet for about 2 weeks to see if that results in any improvement. If you don't see much of a change, then you can reintroduce the dairy after a couple of weeks and watch for any signs of worsening with that reintroduction. Overall, lactose intolerance is a complex subject that should be discussed directly with your pediatrician if you're concerned. Your pediatrician will be able to help determine if your baby is having true lactose issues or if there might be another issue at play. The most important thing is to not try switching formulas without consulting your pediatrician, because this can sometimes delay making the correct formula change that's ultimately going to help your baby feel better. Thanks for watching. If you found this video helpful, be sure to like and subscribe for more. You can also find me on Instagram at Elliston Pediatrics. Don't forget to join Enfamil Family Beginnings for more personalized expert support and guidance.